Dakota Oyate, Denisolun, and Nihitawak nations. We also recognize that Manitoba is located on the homeland of the Red River Métis nations, and that northern Manitoba includes the ancestral lands of the Inuit people. Our water comes from Shoal Lake, and our history on this land begins with Indigenous people. We recognize that there is a deep interconnected history with Black and Afro-Caribbean people in these lands. We carry stories of displacement, migration, and for many of us, resilience. Not as a choice, but as the only way to survive. We honor the generations of Black Manitobans who have built communities here, including those who sought refuge from enslavement through the Underground Railroad, and people who came as immigrants from all over the world, and people who built families, who came here as students and workers, and learned to dream here in this province. Each of us has shaped Manitoba's cultural, social, and economic fabric. We commit to continuing the work of solidarity between Black and Indigenous communities. Before we start, I want to share a few housekeeping details. Today's event will flow through different mediums. We'll have some guest speakers who will share from their expertise and lived experience. We will also have small group discussions. There on your tables, you can see some papers with QR codes. You're invited to use those when the time comes. It'll take you to a direct link where you can answer questions, and those same answers will be projected on the screen up front. So it gives you a little bit of chance if you want to share something anonymously, you can do so through those questions. Also, at the end of the event, there's another QR code on your table where you can share your feedback on a survey. So that one is the blue QR code that's placed on your table. In terms of more housekeeping, the bathrooms are outside to the left. They're gender neutral. And you may have also heard, but you all have access to the exhibits here at the Canadian Human Rights Museum. There are many great exhibits that you can view. The only thing is you do need to have your pass that you were given when you walked in so that you can have access to those exhibits. And that's throughout the day. So if you ever need to step out, if the conversation is heavy, you need to go for a walk, you're more than welcome to go visit some of the exhibits here at the museum. It's a wonderful museum that's at the heart of human rights in Canada. And I invite you to take advantage of that. When we talk about mental health in Black communities, it's a very layered experience, and it's shaped by history, culture, systems, and experiences. We know that here in Canada, Black communities continue to face the lasting impacts of oppression, colonialism, racism, and exclusion. And that has real intergenerational impacts that show on our mental health outcomes today. So research tells us that 95% of Black people in Canada will experience at least one traumatic event in their lifetime. And for many people, that trauma isn't just personal, it's very much structural. It's knowing that you are qualified for a promotion that your colleague will get in half the time that you spent at that company. It's being highly educated and still having your credentials challenged. It's carrying the weight of your family and community and children while trying not to drown in your own stress. James Baldwin has a quote that I love, and it says, "To be Black in this country and to be relatively conscious is to be in a constant stage of rage almost all the time." But still, our communities brush off mental health. We're told to keep pushing, to work harder, that men don't cry, you have to be strong, you have to be independent as a Black woman, until you snap, you break down, you burn out, and your body forces you to rest. It's not just statistics, it's real stories, real people in this room, people we love, people we come from. We have to break the cycle of mental health in our communities, and we can't heal until we address the root causes. This event was put together by the Humanitarian Solidarity for Development and Empowerment Organization. Their team created this event with the goal of bringing people together to talk about the real challenges when it comes to mental health and recovery in our community. So by the end of this day, this event will help us do 4 things. 1, we want to identify the barriers affecting Black youth and families in accessing substance use and mental health supports. 2, we want to understand how stigma and culture influence how we look for help. 3, we want to document the systemic barriers and gaps to service. And 4, we want to gather recommendations to guide culturally responsive programs and designs. As I mentioned before, this day will flow through different panels. You'll hear keynote speeches and small group discussions. Some topics may be sensitive, so if there is any point where you need a break or you want to step out, please feel free to do that. There is a quiet room available, and you can also walk throughout the museum. Today, I encourage you to listen, to share, and to have an open mind. We want to hear from you, the youth, the families, the caregivers, and community leaders. You are all experts of your experience, so that we can move from assumptions to real understanding. Because if we want better outcomes, we need solutions that are shaped by the people who are most impacted. And it's my pleasure to now welcome our first guest speaker of the day. Olson Jarvis is a respiratory therapist and chronic disease management clinician with the Winnipeg Regional Health Authority, working as a part-time of the River East Transcona. In his role, he provides spirometry services and supports individuals living with chronic respiratory conditions through education, prevention, care, and strategies that improve quality of life. Mr. Olson is a certified educator who has completed the Certified Tobacco Educator Program. He has also received additional training in mindfulness-based stress reduction, mindfulness training for smokers, and tobacco treatment for youth and adolescent populations. His work includes lung health education, smoking and vaping cessation, and youth-focused tobacco treatment support. Welcome to share with us.
Hi everyone, thank you for that introduction. So the job I have right now is a job I started in 2018. Before that, I was working in a hospital. And when I was working in the hospital, smoking cessation was a very small sliver of my job. However, in my current job, it is like almost 50% of my job. The one thing that frustrated me about doing smoking cessation in the hospital is that I never got to follow up and see people through the process of quitting. So this new job allowed me that permission or that ability to follow people through quitting smoking. And I was excited because I get to talk to people about quitting. Quitting, everyone knows smoking is bad for you. And if I offer the opportunity to help them quit, they will all take it. And I said to myself, who wouldn't want to take the opportunity? Well, I quickly found out not many people. So I started this job and I'm talking to people about it, and they're telling me that, oh, I'm not ready. That's the most common response I get. I'm not ready. So months into my job, I'm finding that not only am I having trouble finding people who are quitting, but they don't even want to quit. So I had to relook at my approach. And what I did was I actually went to webinars. I watched some YouTubes, read research papers, and I sort of came up with this strategy. And the strategy I didn't even realize was kind of how to build a resilient mind. So what happened that kind of triggered me was one day a client said to me, I don't want to quit smoking because I quit and start again, and I just quit quitting. So what do I do with that? Well, from the reading I've done, what happened was I realized that they hadn't quit in their head. And you're going to understand what I mean by that by the end of the presentation. So in order to quit smoking, what most people do is they will go cold turkey. That means no medications, no counseling, nothing. They just drop it. And some people are successful. However, what the research shows is when you combine medications, or some people will actually use just the medications, and that helps, but when you combine using medications and counseling for behavior change, you actually double your chances of quitting. So that's what I'm going to talk to you today about is is using habit change and mindfulness to not only quit smoking, but to break habits. So, what is a habit? Does anyone have any thoughts about what a habit is? How do you define it? You probably never thought about it. We have a couple of responses. How do you define a habit?
Something you keep on doing without thinking about it.
Something you keep doing without thinking about it. Perfect. Any other responses? Pattern. It becomes a pattern. Yeah, a repeated pattern. So this is the dictionary definition, right? Regular tendency or practice. I know it's very academic, but difficult to give up. Performing behavior without knowing you're doing it, right? Now, how many people think of habits as choices? Oh, some people not sure. Well, has anyone heard of Dr. Joe Dispenza? No, he's big into habits also, and what he adds to the definition is it is thoughts, behaviors, and emotions that are acquired, and this is the important word, is acquired through repetition. So that means you're doing it over and over, but it's learned, right? So we're looking at something that's learned. And if something can be learned, it can be unlearned. And this is how we do it. So we're going to talk about the habit loop. The habit loop is how habits are learned. It's unconscious. You don't even realize that you're learning it, but you're learning it. So, has anyone heard of this habit loop? No one's heard of the habit loop? Okay, all right, so it's new information. So, I learned about this by reading a book called The Power of Habit by Charles Duhigg. I also read Making and Breaking Habits and Tiny Habits, so you can call me the habit guy. All right, so and I saw a lot of connection with smoking and the habits, because I'm talking to patients constantly about this, and I'm getting more and more insights, and they're giving me more insights. So the first thing in the habit loop is a trigger, right? A reminder that, hey, last time I saw this, I smelt this, I heard this, I had a good experience, right? So that's a trigger. And it could be anything. It could be smell of cookies, right? It could be a certain beat that I hear, okay? And that leads to craving, the feeling that, you know, oh, I need to do this because I've heard this, I need to do something, right? Which leads to the action, which is now you've done the action. So if we take these 3 steps from a smoker's point of view, is they've just finished eating and they get this feeling. Some of them can't even explain it, but it's a feeling. And then what they do is they either want the feeling or they want to get rid of the feeling. So they go have a cigarette or they go have a vape, you know, whatever way that they address the feeling. Then they get a reward. And the reward is usually a release of dopamine. So the last arrow goes back to trigger, because what happens is now next time they get the trigger, they repeat the habit loop again. So what we have here is learned behavior that is continually reinforced, and not only is it reinforced, it is repetitive, right? So it's not an accident that we learn to do things and repeat them. So one of the examples I have is I would go downstairs in the basement, come back upstairs, leave the light on. So my parents are like, turn the light off, right? So after 7, 10 years of this, right, you get into the habit, turn the light off. So the other day I'm downstairs talking to my wife, and she's working, or sometimes she's working out. And I'm like, okay, well, we'll see you later. I'll walk up the stairs, and guess what? Flick. And you get this, hey! Right? So it's a habit. And even though I know she's downstairs, I just talked to her. I still flick the light off. Does anyone have any sort of situation like that where you're just doing it without knowing? Oh, Audrey?
So I'm happy to share, because my husband isn't here, that I always signal when I'm driving. And sometimes he'll say, if it's really late at night and there are no cars, why are you doing that? When there's no cars behind you, but it's become a habit.
A habit.
I would like to say it's a good one.
It's a good one, yeah, yeah. So anyone have any other habits or things that they do unconsciously? You do it unconsciously, but you've learned it, and there's been a reinforcement why you're doing it, right? For me, it was like, no more yelling. Turn the light off, no more yelling, right? So the habit loop can be used to learn, but we can also use it to unlearn. So how do we use it to unlearn? Because when we look at the habit loop, the trigger, we can't control triggers, right? We can try to, like, for instance, you know, speaking with my clients, with smoking, you obviously can avoid people who smoke or places where you can't smoke. However, there's other triggers, like your friend comes over who smokes, or your family member comes over who just had a smoke, or you see someone smoking in a movie. I know in Canada you can't do that, but the regulations are not so strict in other parts of the world, okay? So you have this uncontrolled exposure, then that leads to a craving, right? We can't control that, right? At first, you're gonna find that very strong. But then here's where we can break the habit loop, the action. So now you go do the action, but now we're going to talk about in the next slide, how do we disrupt the action part of this habit loop and then create a reward. Reward is interesting because how do you get release of dopamine without doing the thing that you actually have been doing for so long that reinforces the doing of the habit? So when we look at reward, what you want to do, and this is from Tiny Habits, is to do a celebration, right? Like, for instance, when I do something that I want to repeat doing, I give myself a, yeah, awesome, right? It releases a little bit of dopamine, but it's, like, let's not kid ourselves, it's not the same as a cigarette. But what happens over time, and I won't go into this any deeper, is that over time, you will have reduced the need of stimulation of the receptors, the nicotine receptors. And what happens, you're going to be able to cause that stimulation to be stronger. Now, question, how do you celebrate when something good happens? What kinds of words or actions do you do? Awesome. Awesome response. Any others? Yeah, and that's really good for breaking habits or encouraging. Yeah. Any other celebration ideas? You guys don't celebrate? Like, okay, what happened when your team scored, Audrey?
Oh, when Canada scored 6-0 in their game?
Yeah.
I was about to run circles around my street.
Running circles. Yeah, yeah. See, so being conscious of this helps you to reinforce habits. Any other? I think I saw someone else who wanted to share a celebration that they do when something goes well. I'm sure someone here watched soccer and they were happy when their team scored. Okay, what did you do? Yes. Yeah, yes, right? So these things are important because there are ways how you can reinforce your new habit. So how do we break habits? Because we know the habit loop, we know how to celebrate. What do we do with the action? So there's two things I teach my clients: environment change and behavior change. So environment change involves either bringing things closer that you want to do or moving things away that you don't want to do. So for the example of getting people to quit smoking or quit anything, right? One of my vices is cookies. So we put them in the freezer in the garage. So what you do is you change where you normally keep them, right? And when you do that, it sounds very simple. And some people will say to me, oh, I'll just go get them. And so what I say to them, it doesn't matter if you go get them. What happens is you create that delay and that time. And during that time, what you can do is you can say to yourself, hey, I'm trying to quit. What can I do instead? But if they're right beside you, it's easy to grab. And remember, it's mindless. Grab, light, soak, right? Or open the bag, grab, eat, right? Easy to do it. So you change your environment to make it more difficult. Then there's behavior change. So now that you've asked yourself the question, because you've moved it away from you, and you have to say, what can I do instead? That's where new activities come in, right? And there's actually another thing you can do is routine change. You can change how you set up your day so that you don't engage in the habit that you don't want. If it's a habit you do want, then you obviously make it easier. So with behavior change, what kinds of things do you like to do? Do you like actually, let's ask, what kinds of activities do you enjoy doing around the house? Oh, come on, someone's got to have an activity they enjoy. Okay. What? Sleeping. Well, actually, I do have clients who say when they feel like they need a cigarette, they'll go lie down. And that is So that is good. What are the habits? Like, what about watching highlights on YouTube? Yeah? Does anyone play musical instruments? Yeah? Okay? Musical instruments. Playing. See, it sounds like, it doesn't sound very, wow, amazing, but these are the little things in your lives that can help you change your habits or distract from a habit you don't want to do or create a habit that you want to do, right? So the other thing you can do is routine change. This is part of behavior change. Now, when I'm speaking with a client, we don't do all of this at once, but I'm sure you guys don't want to come and hear me multiple times, so I'm just telling you all of it all at once. But routine change. So I have some people, they tell me, oh, I get up in the morning, I grab my cigarettes, have a smoke, go make the coffee, and then I'll go outside, have another one, and then after I come back, and this is the important thing, after I come back in, I'll go watch TV, I'll read the newspaper, I'll go check my email. So what I get them to do, now that they tell me what they do after the habit they don't want, is I say, why don't you do that before? Right? So a couple of things are happening. You're now shifting your mind to think, hey, did I have that cigarette already? Second thing you're doing is you're delaying. You're also adding other activities so that when you feel this way, you actually do something different. So you're creating what I call a new neural connection. So that's how we can use environment change and behavior change to help break habits. But you can also use it to create new habits, right? So one of the examples in one of the books I read was working out. So someone wants to work out, start working out. One of the things they should do, have the clothes, runners, everything beside your bed. And in Tiny Habits, what they say is the habit is getting up in the morning and putting your workout clothes on. Right? That's the habit you want to develop. Once you have your workout clothes on, guess what's going to happen? I may as well go work out. Right? So you go and work out. Now, the one thing that Tiny Habits recommends is don't say, I'm going to work out for an hour your first day. Right? Because guess what happens? I'm not going to do it. I'm going to go for 5 minutes. Right? Go for 5 minutes. That's all. Well, when you're there for 5 minutes, it's like, well, I barely started. Now you're into 10, 15, right? But keep it. And it's something that I actually do because sometimes I wake up and I'm saying, oh, I don't have time to work out. But you know what? It's the habit. So I go and do 5 minutes, 10 minutes, 15 minutes because I want to keep the habit. So the other part of changing habits is mindfulness. Mindfulness is about focusing on the present moment. So it's not about forgetting, because some people say, oh, I can't forget. It's not about forgetting, but it's about distracting the mind. What happens with the mind is, and everyone probably knows about this, rumination. Does anyone ruminate on anything? Yeah. Okay, yes. So now when you're ruminating on something, right, what kinds of solutions are you coming up with? Probably none, right? Yeah, because you're ruminating. So what mindfulness does, mindfulness helps to break that cycle of thought. And when you break the cycle of thought, what happens is now you are able to think or come up with another solution. For instance, something simple like the hydro bill. Oh man, I forgot to pay the hydro bill, and it's middle of the night, and I don't want to get, so you're ruminating about paying the hydro bill. Well, it's like, you know what? I'll get up 5 minutes early. Kind of how mindfulness works. It's not about forgetting. It's about breaking the cycle of thinking and creating a new a new solution. And sometimes that solution doesn't come until you break your cycle of thinking. Now, the one thing about mindfulness is some people say it doesn't work for me. Has anyone tried mindfulness? Yeah, some people have. Okay, all right, well, that's good. Do you find it works? Was it helpful to you? Yes? Everyone found it helpful? Yeah? One of the reasons why most people say it doesn't work is they said, I keep losing concentration, right? One of the key things with mindfulness is when your mind wanders, you acknowledge, remember it's not about forgetting, you acknowledge what happened, what the thought that you had, and let it go. Say, I'm not going to forget you, I'm just letting you go for now, right? So mind gets distracted, you let it go, okay? So that's how we do mindfulness. So I just wanted to quickly show you, this is how I do my counseling, and you can also counsel yourself. You want to assess your situation. Is it something I want to do, get better at, or I don't want to do anymore? Look at your daily routine. Find activities that you like, and you may like activities but not even know, you just do them, right? Then I usually discuss with my clients, well, behavior change, like what kind of environment change, what kind of environments are they in, and what kind of behavior change we can do, and how can mindfulness, now there's a number of types of mindfulness, you got to find one that works for you. And then we discuss how you can disrupt. Then we discuss how to disrupt this, right? It's not always working the first try, but then you keep trying. Okay, so can we do a quick mindfulness technique? Okay, so what you have to do is close your eyes and put your hand on your stomach and just become mindful. And mindfulness is about being aware. Be aware of your hands on your stomach and your shirt, the softness of your shirt, right? The warmth of your hand, right? And just breathe in and out. Is anyone feeling focused? Can everyone feel what's happening to them? Right? And remember, if a thought comes, acknowledge it and let it go. Okay? All right, so we're going to do that for about 30 seconds, and then I'll get you to open your eyes. Are you still feeling the warmth of your hand on your stomach? Are you still feeling the softness of your shirt? Keep focusing on that. Okay, when you're done, open your eyes. What were you thinking about during your mindfulness moment? Nothing? Breathing? Okay.
Distracted by some sound.
Okay.
Mindfully let it go.
Beautiful. That's wonderful. Anyone else? Okay. So, but these. Okay. Oh, but this is actually good because now you have a new awareness. Okay. All right, so that's actually good. Anyone else? Okay. Yeah. 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 Oh, okay. Well, but the thing is, we're going to purposely think about nothing, right? Because especially when thoughts are coming at you, okay? So there are a number of different types of mindfulness techniques, and when I usually do this workshop, I actually it's an hour and a half, and we talk about and do all these different, and it's actually quite fun. But different types of mindfulness. Find what works for yourself. Okay. Thank you for this opportunity, and enjoy the day.
Thank you so much, Olsen, for sharing those practical tips on mindfulness and how we can calm ourselves and break habits, build habits. We're going to invite you to join in on this reflection question. You can, for those who haven't used a QR code, you direct your phone's camera to the image there, and it will take you to a link. And there you are going to see a question where you can give an answer that directly ties with mindfulness and habits. Do you have something for this activity?
No, I wasn't sure how this was going to work out. So.
Oh, okay. I think you can. Let me see. You can guide it, yeah, if you're comfortable then.
Okay, so just look at what responses are.
Yeah, so there's the question here, responses. Okay.
Sorry, I want to put this behind. You want to put
Oh.
this behind?
There's no room though. We need to make this
Yeah, well, I don't know how. I think All right, we got some answers that are starting to populate on the screen. I'm going to ask you to read the English, and I'll support with the French.
Okay. Okay. Over. Oh. Yeah. Okay, we have overthinking, morning routine. So when you think of morning routine, like, are you thinking of changing it so you can do something, or changing it so you can stop doing something? Worrying about job, getting done, delegating helps. That's true. In addition to that, we can say, what can you do, for instance? Does everything need to be done that day? Right? That's part of mindfulness. Like, once you come out of it, it's like, do I need to do everything today? Okay, we have overthinking again. Oh, I keep thinking. I want to change the time of day that I complete my daily walk. I will endeavor to make this change on my own. So this is someone who wants to incorporate something. So they want to create a habit rather than break a habit. So when you're looking at trying to create a habit, again, environment change, what can you do in your environment to make that happen earlier, right? Maybe it's going to sleep earlier, or getting up earlier, or having everything set up so you can go walk with less having to gather things together. Check my phone and social media less. Play with the kids instead. So that's, breaking the habit. So now, environment change, right? The big question I would ask this person is, where are you keeping your phone? Is it in your pocket? Is it beside you? The further away it is from you, the more likely you won't do it. And more likely, and when you get up to get it, you just say, oh, wait a minute, I'm supposed to be playing with the kids, right? This is a French one. Ne jamais.
Et en français, c'est quelle habitude changerez-vous et qui vous aidera? Alors, il y a une personne qui a dit ne jamais reporter à demain ce que je peux faire aujourd'hui. Non à la procrastination. I know a lot of us are probably can relate with that. So this basically just says not to push to tomorrow what you can do today, and to make intentionally not procrastinate.
Yeah, and also push to tomorrow what can be done tomorrow, because not everything has to be done today. So, for instance, if you're a procrastinator and maybe you want to do it today, right? But prioritize, right? And that's where mindfulness comes in, breaking that thought pattern, right? That I have to do everything today, or I can just do it tomorrow. That's the other thing, mindful thing you might want to think about is, like, why am I doing it tomorrow? I don't have any plans today. Okay.
OK. Il y a d'autres qui disent être flexible et s'adapter aux nouvelles choses, de prendre des décisions rapidement. So those two meant to be flexible and to learn to adapt to new things. And the other one is to take decisions quickly. And the next one is laisser trop penser avant de réagir. So you have to think before you react. So I think we'll end it here. Thank you so much for offering your answers to the questions. And as the day continues, there will be more opportunities to engage in these discussion questions. So keep your phones handy for the QR code when it pops up. So we will continue with the program for the day. And we have another guest speaker who will be speaking on the topic of breaking the silence, stigma, mental health, and the power of community. I'm pleased to invite and introduce Audrey Gordon, who is the president of Pearl Consulting and a leader in business innovation, systems transformation, and public service. She brings extensive leadership experience in health, mental health, wellness, and recovery, including her previous role as Manitoba's Minister of Health and Minister of Mental Health, Wellness, and Recovery. As a keynote speaker and panelist, Audrey contributes valuable insight on leadership, system change, public policy, and community well-being. Welcome.
All right. How do we end that? Yeah, sure. How do we end that? Okay, that's fine. Yeah, I'll try to start it there. Good morning, everyone. So happy to see everyone out today. I know it's a bit of a cloudy day, 80% chance of rain, but here you are for today's event. And thank you, Joyce, for your kind introduction. I also want to recognize and thank Ambition and the entire Humanitarian Solidarity for Development and Empowerment Canada team, Sarah, everyone that reached out to me and planned today's event. This is an important time to be talking about mental health and substance use. I think most of you are aware of some of the discussions that have been occurring around MAID, mental health, medical assistance in dying for those with mental health disorders, and just some of the reports that are coming out lately about the rise in mental health illness and disorders and substance use. So today's discussion is important, especially when they involve our young people, our families, and our communities. I'm not an expert here. I see a lot, Dr. Ogo, others in the room that hold titles that they can be called an expert. But I want to say today I speak from a place of lived experience, and so I'll be sharing very personally with you some of my experiences, and I hope that it will bring out some really fruitful discussion. So today I'm going to talk about stigma, how it affects Black youth and families, and how it can prevent people from seeking support, and how we can create communities where asking for help is seen as a sign of strength. As Joyce mentioned, the title of my presentation is Breaking the Silence. That's what we're doing today. Stigma, mental health, and the power of community. Before I discuss stigma, systems, services, or solutions, I want to address a common misconception. And I see some of this even on social media, on LinkedIn. People are using mental health and mental illness, and they're not the same. They're using them interchangeably, and the use of the terms mental health and mental illness it needs to be discussed. So mental illness does not equal mental health. And these terms, like they are on this illustration, are often placed side by side, but they're not opposites. They describe related but distinct concepts. And it's important that we know the difference between the terms, because misunderstanding mental illness and mental health, it can unintentionally reinforce stigma and make it harder for people to seek support. So let's start with mental illness. It affects some people, not everyone. It's a diagnosable medical condition, and some of the examples are schizophrenia, bipolar disorder, or major depressive disorder. And it can impact daily functioning. It often requires treatment and support from a professional, often a medical professional. And then mental health. Everyone has mental health. It refers to the emotional, psychological, and social well-being. It can be positive, neutral, or challenged at different times. It affects how we think, feel, and cope with life. And I like what's written on the screen where it says that mental health exists on a spectrum, and it changes, again, based on life events like stress, grief, loneliness, or burnout. So I want to share a little bit about my personal experience with mental health and some of the lessons that I learned from a very young age. I was born and raised for the first 5 years of my life in Jamaica, and I'm not attributing any of the things that I will share to everyone who is born and raised in Jamaica. But growing up, my understanding of mental health was shaped not only by what I learned, but by what I experienced and witnessed within my own family. As a child, I heard stories about a family member in Jamaica who had died before I was born. I was told that she was mad, because at the time, that was the only language people had to describe what she was experiencing. Throughout my childhood, I also heard words like madman and crazy, along with the Jamaican patois, dopi depandem, meaning that a harmful spirit was haunting someone. And those words carried a message for me. They taught me that mental health challenges were something to fear, something to hide, and certainly not something you talked about. And I know today my story is not unique. Many families carry stories they have never said out loud. But what I really learned was that silence comes at a cost. Over the years, I've seen what happens when people don't get the support they need soon enough. I've witnessed a loved one spiral into homelessness and the justice system because help was not available when it was needed most. I've seen the pain of a family member experiencing a mental health crisis and refusing care, leaving them unable to return to work or rebuild their life. I've witnessed the cycle of addiction where substance use and mental health challenges became deeply connected, making recovery much harder. These experiences shaped my belief that mental health is not only a healthcare issue, it's a community issue. It's about where we live, where we worship, where we learn, where we work, and where we find a sense of belonging. And you know, what we hear shapes what we believe. The words we use matter. Words like crazy or mad may seem like they're just words, but they carry meaning. They can create shame, they can create fear, and they can teach people, especially our young people, that their challenges should stay hidden. While my story is personal, it is also part of a larger reality. Mental health challenges are common, especially among young people. Research tells us that many mental health challenges begin during childhood, adolescence, or early adulthood, which means early support matters. What is striking is the statistics that I show on the screen. First, 75% of mental health problems begin before age 25. 1 in 5 Canadians experience a mental illness in any given year. And sadly, many young people do not receive the care when they need it. The Hsde data shows that 52% of young adults between the ages of 18 to 34 with a diagnosed mental health disorder had completely unmet or only partially met care needs. And this was the highest underserved age group in the country. I was shocked when I read that. Also, 36% of children and youth ages 2 to 17 with a perceived need for mental health care had their needs partially or completely unmet. Wow. So today, I'm focusing my presentation on what I feel is a primary reason, based on my experience, that young people do not seek support, and it's stigma. So I want to spend some time talking with you about stigma and what it is. Let's start with the definition. Stigma is the negative attitudes, beliefs, and behaviors that cause people to feel shame, they fear judgment, or they avoid seeking support. So depending on where the judgment originates, stigma is categorized into 3 primary levels. Self-stigma is the first bubble, and it's also called social stigma. And it's the negative attitudes, prejudice, and discriminatory behaviors. Self-stigma is also called internalized stigma. And it's when an individual, like myself, like one of you begin to internalize the negative beliefs of society, resulting in feelings of shame, guilt, or self-doubt. And the second bubble is public stigma. These are the negative attitudes, prejudice, and discriminatory behaviors directed at a person or group, and it's by the general public. The third bubble, structural stigma, also known as institutional stigma, are the policies, laws, or institutional practices. It could be governments, organizations that intentionally or unintentionally limit opportunities and create inequities for marginalized groups. Stigma in all of the categories that I've shared has real consequences. And the consequences can delay people from asking for help. They can isolate families, and they can make young people believe they have to hide their pain. Now, when someone delays asking for help, and again, my lived experience of this, it's very real. When they delay asking for help because they're afraid of judgment, a challenge that may have been manageable can become a real chronic crisis. For many Black youth, stigma does not exist alone. Black youth experience unique, and I think Joyce mentioned it, layered barriers when it comes to mental health support. And some of these are systemic. So on the left side, the examples are the cost of care. They just can't afford it. And limited access to culturally safe care. At the same time, there are lived experience on the right column, such as racism, academic pressure, microaggressions, and financial stress that also shape mental health outcomes. And you can see that it's not a complete list. So I want to start by just asking the audience, can you name some other systemic barriers on the left side that you feel need to also be added to that list? Anyone? Okay, lack of understanding in how to navigate the healthcare system.
I'll say a lack of representation. So when I do see someone that looks like me, that looks like me, that understand what it means to be Black to me, then I will not be able to
go in.
the care that I need.
Lack of representation when she doesn't see someone who looks like her, or understands her background, she's may be less likely to seek help. How about on the lived experience column? Any examples?
I know which categories are fit on here, but your job, not being able to get time off from your job.
Okay, not being able to get time off from your job because of the job that you're in. Cultural stigma. Yes, yes, very good. Lack of identity and a sense of belonging. Yeah. Yeah, religion. Okay. Oh, wow, very good. Oh, lack of understanding. Yes, yes. So lack of understanding, lack of education in terms of those who should be there to help.
From my perspective, what I do, the systemic barriers, more inclusive policies, straightforward that help to expand
Yes.
access.
More inclusive policies that help to expand access. Very good discussion. So these factors often overlap and reinforce one another. So you see the circles are spread out when we were looking at the three types of stigma, but they can be overlapping. An individual can be experiencing all of them at the same time. And these barriers, the ones that are listed here and the ones that you have presented, they don't just exist around young people. They shape how young people think and feel when deciding whether to seek support. So young people are asking, will I be understood? Will someone see me? Will I be judged? Is this space safe for me? And these questions reflect the impact of stigma and lived experience. So I also want to talk about the fact that these questions, when we look at stigma, operates in our communities. They're not necessarily outside of us, folks. And here is just my examples of how I've seen them operate in the community. Don't tell people our family has problems. Be strong. This one came from my son. Man up. Just pray about it. Others have it worse. Mental illness is a weakness. Now, faith, resilience, and strength are important sources of support in many communities. The challenge comes when those strengths become barriers that prevent someone from reaching out for help. So, even though stigma is real, it's important for me to state that it is not fixed. So similar to what Olson was talking about in terms of habits, we can learn them and unlearn them. We can unlearn stigma. We can move from silence to support. The question is, how do we get there? So let's start with families. Start talking about emotions early. Ask your children and young people how they are really doing. Don't have them come through the door and say, how was today? How are you doing? And then you go off to scan it. We've been talking a lot about our phones, scrolling on our phones. Ask them how they're really doing, and then listen without judgment. Normalize counseling and support. Listen without immediately trying to fix the problem. You hear in counseling and in therapy sessions, or therapists will say, psychiatrists and counselors, that individuals have the solutions within them. They do. They don't necessarily need someone to jump in and be a life preserver and fix it. They need you to facilitate them reaching their own solutions. Second, youth, our young people that are in the room, I hope you're listening. Support each other. Challenge stigma in conversations and share experiences safely. All part of normalizing mental health and mental illness. Third, our communities. Our community organizations, our faith communities, our schools, and leaders play an important role. Create safe spaces for dialogue, like today. I know a lot of organizations are having youth events. Increase awareness and education. Fourth, our organizations and systems. Host more discussions like today's forum. Advocate for access to services. When I was in office as Minister of Mental Health, we helped to launch huddles. And they're all across the city, and it's spaces where young people can get together, hang out, so to speak, and just feel safe in terms of expressing themselves. Provide culturally responsive care. So we've had some feedback from the audience about the need for culturally responsive care. And reduce barriers to support. When each of these levels takes action, silence begins to break. And when silence breaks, something new becomes possible. A community where nobody struggles alone. So I want to close by saying this. Mental health is part of our overall health. Healing begins, though, when we replace silence with conversation, shame with compassion, and isolation with connection. This is the kind of community that we can build together. I also want to leave you with some resources. Practical resources. Conversations like today matter, but access to support matters as well. And these are resources people can reach out to when they or someone they love needs help. And I can tell you that I've had many calls and emails and messages from people in the community asking for help. My help in terms of navigating how to get care for a loved one or themselves. And so I'm sharing with you some Manitoba mental health supports and you can take a photo of them. And there's also community and youth supports like Kids Help Phone, Talk Suicide Canada, and a lot of individuals were not aware, and I've shared on social media, that you can now text to 988 to receive help. So has everybody got that? Yeah, okay. We're going to move now into a reflection question. And like we did before, do you want to facilitate that? Okay.
All right. Thank you so much for your remarks. In response to what Audrey shared with us, I invite you to, when the QR code comes up, shortly, you're going to go on the QR code and go directly to the website. And the question for this section is, what myths about mental health Okay, so the questions are in English, what stigma will you challenge? En français, quelle stigmatisation allez-vous remettre en question? And you're welcome to answer in both French or English. I'll wait for a few to populate and then I can read them together. All right, some of the answers that we can see already. Stigma that we want to challenge is the idea of men doing therapy. That Black men suffer most. The idea to just pray about it. The shame in seeking help. The stigma that men don't cry. The stigma that vulnerability is weakness. That therapy is for everyone. La discrimination est raciale. La discrimination raciale, so racial discrimination. Mental illness is weakness. And parents are always right. I'm grateful for that answer. As we are focusing on youth, we want to hear from youth. I see a few in the room, and I hope that you feel just as comfortable in sharing as everyone else. And a couple more. Don't talk about it. That ladies are always right. And it's not a Black people problem. I want to pause on that one. I think if we're going to tackle mental health and substance use in our communities, we have to recognize that it does happen to us more than you even realize. There is a greater chance that someone in your community, even family, or yourself has experienced some of the topics that we'll cover today. So it does very much happen to Black people. Thank you for your participation. And thank you to Audrey for your remarks and for guiding us through that conversation. So next is a very fun activity. We're going to break for lunch. So we're going to take a little bit of time to fill yourselves and, take some time to talk with each other, get to know the people on your table, the people in the room. We have just over 30 minutes for lunch. So I'll come back and let you know when we can start lining up. But for now, we're going to take a little bit of break. and we'll be back to continue the event together. Thank you. wanted to quickly share that the food is now out, so feel free to outside to your left. There's a table buffet style where you can choose different options, and then feel free to bring it back into the room to eat.
laisse-moi faire.
Yeah, quand tu
D'accord. Continue. Cherche-moi. Ça, je cherche. Hein? Oh.
It's get the word out that people need to support the organization. Sure. Sure. Okay, so it's important for us to realize that mental health and mental illness are not the same thing. They are different concepts. They're related, but they are distinct, and that we not use them interchangeably. Okay. All right, thank you.
Wide. Okay, we can take a video too. A video? So you turn it like this. Okay. There we go. Yes, thank you. Okay. Let me know when you're recording. Good? Hi guys, I am at the Resilient Minds Conference that's hosted by Housing, Sustainability, and
social development, and we're here today with folks talking about mental health in Black communities and how to support youth on how they can get the right kind of support by the right kind of people, because it's something that is very taboo in our community, so we're trying to change that.
it's fine. Just for now. Because then we're going to, I'll put it this way. Just two. Yeah, just two. Joyce? Okay.
All right, hello everyone. Can I please have your attention again? I hope you really enjoyed the lunch, that you feel full and refreshed, that you got the chance to connect with the tables, the people on your table, and maybe learned a new thing about someone new or learned a new thing about the practice that they do in the field of mental health. We're going to continue with the event, and the next order of business is we're going to have a panel conversation with a wonderful group of experts in this field. And I'm going to share quickly the names of the people represented on the panel, and then they'll come join us here at the front, and I will moderate the conversation. And as you listen to the conversation, I invite you to think about questions. We will have an opportunity for the audience to respond and to ask questions. I also wanted to note that it is a bilingual event, so feel free if you have questions in French, we will accommodate for that too. So, the first speaker is Henry Orawete. Henry is a mental health professional with academic and clinical training in psychology and psychiatric nursing. He holds a Master of Science in Clinical Psychology, a Bachelor of Science in Psychology, and a Bachelor of Science in Psychiatric Nursing, and is a registered psychiatric nurse. He currently serves as a psychological associate, independent practice candidate, and with Dr. Ian Muglivsky, C Psych and Associates, and as a registered psychiatric nurse at Selkirk Mental Health Center. His combined background in psychology and psychiatric nursing informs his work in mental health, assessment, care, and support. Welcome to the front, Henry. Next, we have Dr. Ogo. Dr. Ogo serves as Manitoba's Chief Provincial Psychiatrist and Director of Psychiatric Services and brings more than 19 years of experience in psychiatry. He is also an assistant professor in the Department of Psychiatry at the University of Manitoba. In his provincial leadership role, he provides expert guidance on mental health policy, practice, and legislation, while supporting psychiatric services across Manitoba. Dr. Chukwujama earned his medical degree from the University of Nigeria, completed psychiatry residency training in Ireland, and holds a master's degree in psychiatry from Cardiff University. He is a fellow of the Royal College of Physicians and Surgeons of Canada and is committed to advancing equitable access to quality mental health care and mentoring future health professionals. Welcome, Dr. Ogo. We also have Dr. Salimot Salawu. Dr. Salimot Salawu is a psychologist candidate with New Directions. She holds a PhD in counseling psychology and a Master's of Education in guidance and counseling. She's also a Canadian certified counselor and a member of the Psychological Association of Manitoba and the Canadian Counseling and Psychotherapy Association. Her work focuses on mental health, resilience, personal growth, and supporting individuals in strengthening their well-being. So welcome, Dr. Salimot. And finally, we have Janelle Delorme, who is the Manager of Indigenous Relations, Equity, Diversity, and Inclusion at Centre de Santé Saint-Boniface. She is a Francophone Red River Métis woman from Treaty 1 territory and the homeland of the Métis Nation. Janelle is a community activist, a drum carrier, and the mother of 2 children. Her experience spans fields including international solidarity, education, and health. She is a seasoned conference speaker and workshop facilitator, particularly on topics related to truth and reconciliation. Janelle is the recipient of the 2022 Champion of Indigenous Education Award, presented by Full Circle for Indigenous Education, as well as the 2023 Caritas Award in recognition of her efforts towards reconciliation. With a master's in community health sciences, she is deeply engaged in advancing sustainable, equity-driven transformation in health. Welcome to the front, Janelle. We have Madipa C. Madipa C is a crisis counselor at Clinic Community Health and an adolescent mental health counselor at the Manitoba Adolescent Adolescent Treatment Center. In these roles, she supports youth experiencing mental health and addiction-related challenges. She holds an applied counseling certificate from the University of Manitoba and is currently pursuing a master's degree in counseling psychology at Yorkville University. Her professional background also includes work in domestic violence support. Mandeepa brings professional experience and lived experience related to addiction and mental health, grounding her work in empathy, honesty, and a deep commitment to community healing. So welcome to the front, Mandeepa. And finally, we have Mr. Shaman Brown. Mr. Shaman Brown is a registered social worker, therapist, researcher, educator, and founder of Shaman Brown Counseling, a Winnipeg-based counseling and consulting practice. With over 20 years of experience, Shaman understands trauma, sexual and gender-based violence, complex mental health, and the wellness and lived experience of communities. She specializes in decolonial, anti-oppressive, relationship-centered approaches that recognize the impact of culture, identity, systemic inequalities, and intergenerational trauma on health and well-being. Shaman serves on the board of directors of Heartwood Healing Center and has completed research on the wellness of lived experience staff in the gender-based violence sector. Her research identified a central finding: wellness is relational. She is passionate about advancing culturally responsive, community-led approaches to healing that foster belonging, resilience, and well-being. So as you can see, we have a wealth of experience on this panel. And we are so excited to hear from you as we go through some of these questions. All right, so I am going to direct the questions to each person, and then I'll pass the mic to you. And if anyone wants to add to their answer from your area of expertise, I welcome that answer too. So we're going to start with Dr. Ogo. What do you see as the most pressing mental health and substance use challenges facing Black youth and families in Manitoba? So in your answer, I want to hear more about what kind of changes in policy or access to care or early intervention and even culturally sensitive services that we really need to support the different identities and values of underserved communities across the province. So it's a loaded question, but I believe you can answer it very well.
I'll do my best. Can you hear me okay? Brilliant. Thank you for that question. And before I get into it, I just want to thank Ambition and the team, the HSDE crew for arranging this. I think this is it's very timely. I think it's quite impactful, what we hope to achieve here. And I think as somebody that is into organizing things and trying to get community engagement, I'm really impressed by what the team has put together. And I think we should all give them a round of applause for this, please. So, to the question that you asked, it's a loaded question. What is the most difficult aspect that I find with access to mental health for youths and addiction as well? I think it's been addressed partially already, which is stigma. And if we're looking at this room, it's most of us are African descent here, and there's a lot of difficulty when it comes to mental health and language that we use in mental health here. If you think about it, there's a lot of languages are spoken in this room, but I bet you a lot of languages here do not have a name for depression. They do not have a name for psychosis. Like the Honorable Minister mentioned earlier, we just use the word mad. And part of that is it's cultural. And the reason we're having this today is to address that. And when I say cultural, I mean exactly that. Like, it's very cultural. It's this deep-seated need to not talk about this, not discuss this, within the family, within families. I'm Nigerian. I was born in Nigeria. I grew up in Nigeria. I left Nigeria when I was 29 years old. So, fully ingrained African before I left. And here's one thing I noticed, and I'm going to speak to where I come from, but I wouldn't be surprised if it's the same in other cultures. Nobody talks about mental health because, well, from where I come from, we have this nasty negative eugenics. I'll explain what that means. Nobody wants to marry into a family with mental health problems. So we don't discuss it. We pretend it doesn't happen. We pretend that this thing that happens to other people doesn't happen to my family. So when it pops up in our family, we sweep it under the rug. We don't want to address this. And because of this, we have habits, to choose Olson's talk, that is geared towards trying to hide this mental health illness that we have. And therefore, we don't address our mental health. So if you've got this happening at the family level, within African communities, well, so we're all here now. We carry a culture with us to this new land, okay? And unfortunately, sometimes we get caught up in looking at systems on why it doesn't let us get into something, or it doesn't let us get access to services that we think we should get. But when you're pointing a finger, you got to realize you've got three pointing towards you. What is it about our culture that makes us not access mental health services like we should? When we don't discuss these things at home, when we don't discuss these problems amongst ourselves because of that stigma, that shame, well, we're not looking to use the service adequately. And more importantly, when we do use the service, because it will bubble up into the surface eventually, we are looking to access it a bit too late. We want to catch mental health difficulties early enough on the journey towards whatever is in front of the doctor at that point. But if we don't start early to get comfortable to discuss these things amongst ourselves, get comfortable telling ourselves the truth. And I'm sure we're all mostly religious based here, but even within religion, we need to be honest about what's going on amongst ourselves. And part of that is kindness to ourselves, because we need to tell ourselves the truth. Go to your pastor, say, hey, I have a family member who's struggling. When we start to have these conversations, when we start to feel comfortable having these discussions, seeking help early, we start to access help at the right time. Because we start to access help at the right time, we also start looking to change policies because we want to get access to these issues. We start to ask the questions, how can I get the phone number to get access for youth drug issues, or an adult with an enduring mental health problem, or somebody who we suspect, we don't know, but we suspect might be sliding down into serious mental illness. We start to ask the questions early enough. So for me, I look at it as a two-pronged problem. There's the issue we have in our community about stigma, about communication or lack thereof. And then there's also policies, access to mental health that we need in our communities. We have to build both at the same time. If we believe that we deserve good mental health, If we believe that we deserve the best that we can from services around us, then we start to advocate a bit more. And that is what we're doing here today. That is why there's a lot of different health leaders and different leaders in different churches, services in this room. So each and every one of us is a mouthpiece towards pushing this information out from this forum. So as an answer to the question, that's what we're doing right now. But I really think we need to work on the stigma. Another example that makes sense for this is, if you look at the youth that we worry about today, they have the lowest levels of teenage pregnancy in generations now. They have the lowest levels of drink driving or drunken behaviors. They have lower levels of cigarette smoking, HIV infections. And we have to ask the question, why is that? That's because we've had decades of public health messaging, talking about these things, highlighting it, so that they are already seeing the results of all that work that's been done in public health to improve things. We have to do the same thing for mental health and stigma. And that is what we're doing today. And I hope at the end of this, with this beautiful panel that we have, we can address this stigma, this lack of communication, and hopefully people can think towards positive results about how can I get access on time? How can I do this on time? How can I communicate this on time with my person, my neighbor, anybody?
Thank you. Thank you, Dr. Ogo. You really touched on many different things in that answer, and I think one thing that stood out was language and how we might not always have the language to describe experiences with mental health, mental illness, and substance use in our individual cultures. And on that same note, Shaman, I want to ask you to talk a little bit more about those layered experiences. Many immigrant parents, they make tremendous sacrifices by leaving their careers, their homelands, and their support systems to give a better opportunity for their children. But because of this, some youth actually hide their struggles because they feel guilty, suffering despite their parents' sacrifices. So how can parents communicate? What language do they use to show both love and high expectations while ensuring that mental health challenges are not viewed as a sign of weakness or betrayal or betrayal of the family sacrifices?
I'm going to try to do this without a mic. Can I do that? Or do I have to use a mic for like audio reasons?
If you can use a mic because there's translation happening at the back.
Okay, yeah. All right. I hate mics, guys. So when we're thinking about the sacrifices that parents make to come here, and the desire of youth to honor and respect those sacrifices, it makes sense that they may not feel comfortable sharing how they're feeling, but I think that also comes from, I think Miss Gordon spoke earlier about how families can support or be a part of mental health. And it starts with being available. It starts with sharing space, being mindful of how much you're taking up. As parents, we might say, this is who I want you to be. This is what I want you to do. This is how you need to show up in the world. And we're not asking questions. We're not saying, who do you want to be? How do you want to show up in the world? Right? So I think first just creating a space of safety for folks to discover themselves, and then normalizing not just mental health, but also normalizing wellness. So I can ask you if you're feeling okay, but do you have the tools, if you're not, to address that? Right? We are still living in a space of being reactive instead of proactive. When my children show that something's going wrong, I'm going to ask them if they're okay. I'm going to get involved in the conversation, when really that should be a conversation that's ongoing. Let's talk about emotions. Let's label them. Let's also talk about why certain foods might be more helpful for our mental health, why exercise and movement is important for our mental health. Let's not just talk about it, but do it with, because now that's an act in bonding and therefore belonging. But it's also reinforcing those neurological pathways for the child so that when they're an adult, they already know what to do to support themselves in their wellness. I think the last piece that I would add, because I want to make sure that folks have space to speak, is that we have to outright communicate, yes, these are things that I want for you, but it's also okay if you don't want them for yourself. We have to give people permission to be themselves, explicitly spoken. We can't imagine that because we love them and they know we love them, that we know that we want them to be happy doing whatever they want. We have to tell them that. We have to remind them when they make mistakes that they are still valuable, that they are still worthy in our eyes as well as the world's. We can't assume that they know that. And that's how we create a space where they can go out into the world and even run into someone whose love is more conditional and not be fazed by it, and not internalize the voice of that abuser or that unhealthy person, because they've already internalized the voice of their families and their parents that says that no matter what, I am enough.
Yeah, I want to agree with Shannon on that. It's very important that, okay. Oh, okay, sorry. I'm not used to using this. It's very important to, like we said, of course, we've sacrificed a lot moving down here, and we know it might be so, like, can I say embarrassing when we see our kids not appreciating what we've done for them, the sacrifices we've made for them. So but still yet we need to realize that we are here because of them, and we want the best for them. And when we see that they are going through these mental health challenges, we should be able to recognize the experiences that they are going through, validate their experiences, help them to recognize, label, like she said, you label those emotions, let them know, okay, oh, I can see you are struggling with that. So when they hear that, they feel like, oh, so I feel understood, I feel seen. Then we give them this cultural support. It's very important not to, look at our kids like, what are you talking about? Being reactive about whatever feelings they are sharing with us. We have to be able to recognize the fact that they are human, and mental health is a human experience, and they need, you have to give them chance to express themselves. And when they do this expression, you don't have to undermine their expressions. You need to validate those emotions for them, validate what they are going through, and providing this supportive environment for them for you to improve their well-being and navigate through the life challenges of life. Yeah.
I think, and you can do that by still being honest. It's not a matter of choosing what they want versus choosing what you want. My kids do not live according to my values. I've raised them in feminist circles forever, and they didn't pick up what I was putting down, okay? But I will tell them when we have conversations and they challenge me with their beliefs, I can say, I respect your right to believe that, and I even can see why you would believe that. I disagree, right? Or if they're making choices that I don't love, I can say, well, I'm really worried about that choice because, I can see it leading to this, or, whatever. Here's some resources in the event that you want to address that, but in the meantime, I'm here and I support you. So we don't have to agree with everything that our kids say. We can still infuse, add our values.
Yeah.
Sorry.
No, it's fine.
One more thing. Okay. As a therapist, I want to just say this, because I want folks to take this home with you, okay? And it's not fun. I cannot name one single person of color who's been in my office who, when raped or dealing with addiction or feeling incredibly depressed, could name a parent that they felt safe to share with. Maybe a sibling, but not a parent. And so, and for different reasons, maybe because of the cultural, they would feel, if they'd been violated sexually, they dishonored the family because of cultural beliefs, they would be blamed. If it's addictions, they're ashamed to the family, their family works so hard and they're dishonoring their efforts, right? But there's no safe space for them. And the friends that they're talking to often have been very westernized. And the feedback that they're getting is not educated, right? Yeah. So we need to be those safe places. Even if not to our own children, then to someone else's.
Yes.
Just be, like, that's the number one thing that I always say to youth is, do you have a safe adult? Is there someone who's smarter than you that you trust and feel safe with? And if we can be that to one kid, we're doing our job.
Wow. Very well said. Very well said. Being a safe space is so important, and I encourage you all to think about maybe one person in your life who you can reach out to or commit to being that safe space for them. The next question is for Mandeepa. Many Black youth and families have been shaped by experiences of trauma, racism, domestic violence, family separation, migration, and displacement. So these experiences can affect mental health and increase vulnerability to substance use. What can you say to families or communities and service providers on how they can recognize these hidden wounds and create a space for healing, resilience, and healthy coping strategies while reducing stigma and promoting early support?
Thanks for that question. I think you said it in there. You talked about coping mechanisms, coping strategies. I think one of the biggest issues with addiction is that it is often viewed as a moral failing. It's viewed as somebody being weak-willed. And that is incorrect in my personal experience, because I am now 6.5 years sober, and also in my experience working with people who have addiction. It's because oftentimes people do not know how to cope with the difficult things that they go through in life. And a lot of that stems from not being taught how to cope in childhood, right? And so I think I'm just kind of echoing what a lot of folks up here have been saying just on this panel and earlier today. We need to start having these conversations with our kids at a young age, right? We need to be able to identify what feelings we're feeling, how to cope with difficult feelings, how to cope with stressful moments, you know, and it can look like so many different things. I think as adults, you might do it without even realizing that what you're doing is a coping mechanism. Going for a walk, calling a friend, taking a nap, eating something, exercising, those are all coping skills. And it's important to name that to a child and encourage them if they're tantruming, if they've had a hard day at school, if they're experiencing difficulties with their friends or feeling overwhelmed with a school project, to talk about, okay, what can we do to help you feel better in this moment, right? Do you need a snack? Are you tired? Like, do you want to scream into a pillow? What can we do? And those habits develop and they stay with us into adulthood. And those are protective factors that keep us from relying on drugs or alcohol or gambling or sex as habits that help us cope with whatever feelings, right? And like Mr. Olson was saying earlier, it becomes a dopamine hit, right? When you're struggling and everything feels horrible, you do this habit, this behavior that's unhealthy, and then you get a dopamine hit and you feel better. So how can we teach, because I believe in preventative action and being proactive. So how do I teach a 5-year-old to get a dopamine hit from going for a walk or playing with a toy, rather than all of a sudden at 17, they have a drink with their friends at a party and they get the dopamine hit from alcohol or smoking a cigarette or, you know, trying some weed. Addiction runs in families. That there's so much scientific data that supports that. Like it is in our genetics. But again, protective mechanisms. So first of all, acknowledging that it exists in our families, because, you know, I know Southern African countries where my mom's family is from, drinking is so common, but it's just normalized. And yet, realistically, most of those people I would consider functioning alcoholics. Functioning. I don't even really like that term because it implies that you're fine and you're not fine. So we, like, understanding that it runs in families and what that looks like. Just because you're able to go to work every day and pay your bills does not mean that alcohol or drugs are not having a debilitating impact on your life. Yes, trauma will make you more susceptible to it. Childhood trauma, life trauma, being in a horrible car accident, losing a family member, going through an illness, all of those things can impact our resilience and our ability to recover from these kinds of circumstances. But truly, I believe if you teach a child to develop that resilience from such a young age, it becomes a habit, right? And then they know to reach for talking to someone or one of their coping mechanisms that they've been doing since they're 5, to cope with their difficult moments instead of using sex or porn or, shopping or gambling, or all of those things are addictions. Exercise can be an addiction, right? Any addiction is any behavior that is detrimental to your life, that is having a negative impact or like getting in the way of you doing what you need to do on a daily basis. And so it's not just substances, and it's not a moral failing, and it's not weakness of character. It's not having the skills to cope with life's difficulties, and it can impact everyone. And my personal experience, I'll finish with this. When I first got sober and I was told to go to AA, Alcoholics Anonymous, I was like, it's going to be a room full of old white men. Like, what am I going to do in there? I was 25 years old. I did not think that was a space for me. And yet, the first official meeting that I went to, it was a women's meeting, and it was like young women who were in their 30s and 40s, and they looked like teachers and soccer moms. And I was just blown away, like, oh, this can really impact almost anyone. And I think that's, it was again like one of those moments of, okay, representation is important. We need to talk about this in all communities. It can impact anyone. Addiction doesn't look one particular way. And so that's part of why I'm very open with my personal experience, because that's how I choose to destigmatize this topic. And so, yeah, I think, just to wrap up, like, teach your kids how to cope, how to talk about their feelings, make space for them, do not invalidate their feelings. A 5-year-old can feel stress. Like, it might seem silly to us as grown adults who have bills and jobs and whatever, but stress is a physiological response, and anybody can feel it. And a 5-year-old can feel angry, and a 5-year-old can feel sad and anxious. And if we teach them how to cope then, when they're 25, when they're 30, they'll know how to cope then. I'll leave it there.
I think I want to add to that for what Mandipa said.
I'll add after that.
And then me.
What do you want to say?
No, after you.
Oh, okay.
It's such a good question, yeah?
Yeah.
Okay.
So I think she really did justice to that question. And on top of that, I want to add the fact that when you talk about trauma, you need to look at things through the lens of trauma-informed approach, where you tend to recognize that people are struggling, they are going through lived experiences that are impacting their mental health, and helping to provide safe and supportive environment for them to share their struggles, their concerns, really, really matter. And empowering them with tools, strategies, and ways to navigate their way out of the old struggles really, really matter. And I think healing comes when people don't feel less judged and feel supported, understood, respected. And I think, yeah.
Thank you.
So I think that's a great question, and I love the way you approached the answer. I also love that you were brave, you were open about your difficulties, and I'm not trying to make excuses for parents as well, but part of what was asked was the trauma for migration and being different parents from what your kids are. Sometimes we also have to recognize the struggles that the parents go through. We are living in a time when Canada opened up its borders and asked the best of the world to come to Canada. And So you find parents coming with kids. That's a very difficult migration. And I'm sure a lot of people in this room have experienced that. And then you add to the fact that you've upended all of your life and moved to a new country. There are difficulties in that new country nobody tells you about. For instance, if you're coming from Africa and some other parts of the world, your educational qualifications are not recognized. So you have to, while looking after your family, re-educate yourself, recertify all your certifications. You will have to pick up jobs that are below what you were trained to do with that frustration. And it might take you 3 years or 5 years or 6 years to get back to what you left behind in your home country. And this is all while you're trying to ensure that your family is feeding, everybody stays sane, you're providing them with housing, you're providing them with good education. So you now have this parent who is also traumatized by this move, even though he's not talking about it, or she's not talking about it. And it's a miracle that the family doesn't break down. You've got parents who are quietly fighting and trying to protect the kids from seeing this in the home. You've got kids who, when you think about it, our children spend Monday to Friday, 8 hours, away from you, with society, with the teacher, with the classmates. And then the child comes back to you, say, you're back home 5:30, they're in bed by 9. You barely communicate with them. Society knows your child more than you do. And it's not because you don't want to, but you're exhausted, you're tired. But you have to still put in the work to try and know your child, know your child's friends. So I'm not making excuses for parents, but I'm mentioning this because the parents too are traumatized. And that's why they're not as present as they should be. It's back to communicating the things we should talk about. If we realize that, hey, I'm stressed out, I'm struggling too, and men are terrible for this. Women, you've got your shit together. You cry together, you talk, you feel better. But men, we have this need to be the rock of the family. So you're not discussing this with anybody. You're not sharing with anybody else. And you're struggling. You've just got barely enough to keep the family going, and you're not engaging with the most important assets in your life, your children. So are we surprised that if we're not discussing and dialoguing about these things, that the family unit is struggling? But if we recognize that, hey, I'm stressed out too, I need to recertify, I need to go back to school to get these things, I need to suspend my idea of myself and my ego and take those lowly jobs initially until I get to where I want to get to. And I'm going to deal with all this stress and deal with my family at the same time. When we recognize this issue, well, then we forgive ourselves. We actually consider discussing this amongst ourselves, normalizing what we're not used to, and recognizing that we need to help ourselves first, help this trauma that we're going through, so that we have something to give back to the kids. So I think that's another major area we have to, it's all back to, again, communicating and talking about and destigmatizing these things we don't talk about. I felt it was important I mentioned this. It's not excusing parents from responsibility, but at the same time, it's recognizing the difficulties that we have.
Yeah.
Thank you.
Thank you. I like that you acknowledged trauma. I also like that you acknowledge the responsibility of folks who are experiencing trauma to actively work towards resolving it. because without that piece, it is an excuse. I have a history of sexual violence, crack addiction. I was prostituted for a number of years, and I raised 3 sons on my own. And if trauma was an excuse for not talking about emotions and not teaching resilience and not growing together, if that's what needs to happen, hey, I learned this thing, let's practice it together. Let's make this a part of what we do. Let's find 10 minutes a day, just you and me, one-on-one, so you can talk about whatever you want. We can find that time, regardless of what we've been through. We can find that time for ourselves and for others. And if trauma is the excuse for not being present, then yeah, we have a responsibility not just to ourselves, but to our children to get support for our whole family, if that's what needs to happen, right? Also, when we talk about addiction amongst our youth or even ourselves, I think it's really important to be mindful about how we're labeling addiction or how we're defining addiction. You can drink alcohol and not be an alcoholic. And I don't get to tell you if you're an alcoholic or not, right? I don't get to decide if the amount of alcohol you're using is disruptive to your life. I can tell you if I'm concerned. I can tell you, I can show you to resources, but the piece about that can become really disruptive for folks is when you're telling someone who doesn't identify that they have an addiction that they are, because what you're doing is closing a channel of communication, right? We don't get to live other people's lives. We only get to live our own. We can do that from a place of truth. You know, we can speak in kindness and in love, right? We talked about, Mandeepa talked about prevention and having those conversations. And what I found, when my kids turned 13, I told them, you're now officially in training to be men. In 5 years, you're gonna be able to make any decision you want. And my job is to teach you how to make those decisions, right? So I'm no longer gonna tell you, go do this thing because it's good for you. I'm gonna say, I think this thing is good for you. How do you feel about it, right? What are the pros and cons? We have to teach our kids how to think. We have to teach our kids how to trust themselves. We, even like when we think about migration and stuff too, we've been conditioned by colonialism to obey. Mm-hmm. We've been conditioned to assimilate. We've been conditioned to be like them so that we can succeed and rise. But we need to teach our kids more, right? We had to do that, sure, to pave the way. But they don't have to do that. They don't have to do it our way. So how do we teach them now how to trust themselves, how to start thinking through problems, thinking through their options? And I think I said this already, but I'll say it one more time. Last thing is harm reduction. So if folks are struggling with something, whether it's substance use or exercising too much or working too much, maybe the first step isn't to tell them that they need to stop. Maybe the first step is to see if there's ways that they can reduce harm. In counseling sessions, that might look like, hey, you know what, the last few times you've told me that you've been drinking for 3 nights in a row, you've been in some pretty dangerous situations. Do you think next time you could cap it at 1 day? Or who could you bring with you next time that will keep you safe? How do we reduce harm? Because once they experience safety, they want more of it. But if all they're experiencing, especially from the people they love, is shame, they're just going to become silent and they're going to get sicker.
Mm-hmm. Thank you so much, Shannon. You mentioned the impact of colonialism and how that conditions us to learn to obey. So I'm going to direct the next question to Janelle. I'll ask it in French if that's okay. Feel free to answer in either French or English. Happy to translate. En tant que leader autochtone qui travaille dans le domaine de l'équité, de la diversité, de l'inclusion et de la santé communautaire, vous comprenez les répercussions profondes du racisme, de la colonisation, des traumatismes intergénérationnels et des inégalités systémiques sur le bien-être. De nombreux jeunes noirs de première et de deuxième génération au Manitoba disent se sentir partagés entre plusieurs cultures et éprouver un sentiment d'appartenance fragile. Alors, en vous appuyant sur les approches autochtones en matière de guérison et de renforcement des communautés, que peut-on apprendre des communautés noires, ou que peuvent apprendre les communautés noires et autochtones les unes des autres pour réseauter le sentiment d'identité et favoriser la fierté culturelle, le sentiment d'appartenance et de mettre en place des réponses communautaires qui renforcent la santé mentale, la résilience et la guérison d'une génération à l'autre. So, in summary,
Yeah, do you want to ask it in English?
yes, in summary, as an Indigenous leader working in equity, diversity, and inclusion, you understand the impacts of racism and colonization and intergenerational trauma when it comes to well-being. So many first and second generation Black youth in Manitoba describe feeling caught between two cultures and struggling with a sense of belonging. So I'd love you to, if you can draw from Indigenous approaches to healing and share what can Black communities learn from those Indigenous approaches to healing to foster cultural pride, connection, and community-led responses.
Awesome question. Huge question. Anybody want to take a course? Because I'd be happy to do a full university course and multiple university courses on this topic. In fact, I want to thank Ambition and his team. So maybe one of the reasons I'm here and that I've accepted the invitation, because it's an honor to be amongst you all, is that every year I'm an invited guest in the social work program at Université de Saint-Boniface to talk about Indigenous harm reduction. So harm reduction from an Indigenous perspective. And by the way, harm reduction is actually an Indigenous way of being and doing that has pre-existed any public health. By the way, I did my formation in public health, but it predates, so harm reduction from an Indigenous perspective predates any like colonial forms of public health. I'm Red River Métis. It's always amazing to talk to folks as a person of these lands, from these lands. Just to give you a little bit of context, so in my family, and I know this is not the case for every family, we always knew we were Métis. However, due to colonial systems, a lot of Métis families were shamed. And because of our, I will say, mixed ancestry, many Métis folks would be able to pass as white. That was a protective mechanism. They had to choose to do that. So it is not because the family felt that they needed to hide, it's because society made it that they felt that they needed to hide for self-preservation. So that is maybe a different dynamic from other communities, and I always ensure that I only speak from my family's lived experience, our lived experience, and my community's experience. Although Indigenous peoples, we are not a monolith, but we share a lot of the same cultures, values, ways of being and doing. There's also a lot of differences between Indigenous nations. So I just wanted to kind of give that context. I'm also an intergenerational survivor of residential schools. My great-grandfather could not pass as white and was taken from his family, and actually he was raised in Saint Laurent, so St. Laurent, Manitoba, along Lake Manitoba, and was actually brought to St. Boniface. So there used to be a residential school right here, or like right across the river in St. Boniface, called l'École industrielle de Saint Boniface, the St. Boniface Industrial School. And so what I would say is, and I feel like my generation, so I grew up in the 80s and 90s, I feel like my generation is probably the generation that is reclaiming their indigeneity. I think we see it in society. I think many of us did not grow up with necessarily our culture outwardly, right? So in high school, I learned about Indigenous people in a very Western colonial way. It was not cool. But we were not outwardly loud and proud about who we were as Indigenous people. But my goodness, do I see such a difference in schools these days? I think it's schools in part. I see such a difference where kids are invited to be able to be proud about the culture or cultures that they have. And often when I facilitate sessions and sharing circles, especially with a diverse group of people, what I notice when we have an opportunity to share, or we're often sharing in circle, is when I share my life experience and my family's experience, I have a lot of newcomer families or second generation saying, my family lived the same thing. It's the colonial impact the colonial recipe is the same. It might have not looked like residential schools, it might have not looked like CFS, but the recipe is kind of the same and the impact actually ends up being relatively the same. So I often say we have parallels. Rather than saying, oh, it's the same, it's parallels. So we've lived similar things. So what I see in terms of addictions, in terms of like substance use disorder, in terms of homelessness, the underlying factor is disconnection. So we're looking at disconnection. And it could be disconnection of culture, disconnection to community, disconnection to those safe and important conversations that you're having with safe people in your family. And disconnection can be in part because of traumatic events that either yourself or your family has lived. So the parallel that I see in terms of, for example, second and third generation youth is I hope these young people want to be proud of their own culture. Yet I do know, even studies have come out, the dynamic of now my family has migrated here. I am not like my parents. I want to be more westernized. Like the studies are out there. We're showing the studies of like that disconnect or that difference between first, second, and third generation and so on, right? We're seeing that difference. But what I would say is that connection. So growing up in your culture, growing up with your languages, and so you don't necessarily need to be quote unquote fully assimilated within society. The word that I like is that we are integrated, is that we can integrate within society and we can function, but we can still be our own selves, be of our own cultures, speak our own languages, and so not feel like we need to succumb to the pressures of colonial systems. Now, in terms of harm reduction, so harm reduction in part can be, yes, harm reduction supplies, harm reduction tools, but really at its foundation is about creating safe and inclusive spaces. So harm reduction can actually be, it is a way of being and of doing and a perspective that can be used within very different communities. But it's about reducing that harm. But how do you reduce that harm? You have to there has to be a safe space to be able to meet people where they're at. So Mr. Olson here, who said, well, I can't get them to stop smoking. Well, first we have to meet folks where they're at. And where can we meet folks? Where can we actually suspend our own judgment? Where can we suspend our judgment? And where can we meet the person who, with all their courage, has decided to share something either deeply traumatizing or a secret that they've been holding or something, and how can we be that person to just sit and listen? not find a solution for them, because in the end, the solution is within themselves. They can decide, they can choose what they want that to look like. And their choice might not be the same choice that I would make, but can I suspend that judgment while I'm sitting next to this person? And should this person want support and accompaniment, can I offer those tools and the things that they may express that they need? So I think from this perspective of someone of a different culture, but with kind of similar lived experiences, I can see the parallels between the impact on Indigenous communities here on these lands, and also the kind of disconnection of that certain second and third generation are living. And it is having an impact, and we do have to be open, and we do have to talk about that. I was just talking to Nadia, and she's saying, I'm raising my kids so then they know their own language. And I'm like, good for you, because that's super important. And I made that same decision with my family, that we're raising them to learn French, because French is one of our mother tongues. I would love to learn Michif, because that is another one of our family languages, and that opportunity was stripped away from our family because of residential schools. My great-great-grandmother and great-grandfather both spoke Cree as well, and that is also another thing that was stripped away from us. But now, as an adult, I can make that decision to regain that knowledge and regain and reintegrate myself fully into my culture.
Thank you so much.
Thank you.
So because of time, we're just going to go straight to the next question, if you don't mind. I want the audience to also have an opportunity to respond. So I'm going to ask you to prepare your questions. I'm going to ask the last one, and then the way we'll do it is we'll get 2, maybe 3 audience questions. You'll ask them all at the same time, and then the panelists will respond based on the one that they choose. So then we do the best with time. Okay. So the next question is for Dr. Salimot. In many African and Caribbean cultures, a lot of people can express emotional distress through physical symptoms. People talk about their body feeling heavy, their heart hurting, feeling fatigue and extreme tiredness. So this is they express these symptoms rather than words like depression or anxiety. So when youth use Western mental health language to describe their struggles, they may be seen as exaggerating from elders in their communities. So how can families help bridge these differences between language of vulnerability, emotional expression, and healing?
Yeah, thank you for the question. I remembered, was it last week or 2 weeks ago when I was talking to my son? And he was like, Mom, I'm going through anxiety. I was like, I was like, what do you mean by that? What's going on? At some point, I had to readjust myself and compose that, psychologist. So it was kind of funny, Sometimes you might be biased when you're dealing with your own, close relative, but I don't know if that really makes sense to you guys. So what I'm trying to portray is when he mentioned that, I was like, okay, so what's going on? Because normally back home, people don't express like that. For me, if I want to talk about probably I'm going through anxiety, I'll be like, say, oh, my chest is so heavy. As in, my heart is palpitating hard, seriously. And I don't eat. I won't be able to eat, loss of appetite, lack of sleep. Those are the ways we communicate. But one thing I've realized is we shouldn't, as parents or caregivers or whatever the case, we shouldn't dwell on the language. We shouldn't dwell on the terminologies. It's always very important to focus on the feelings underneath the words so that we can actually provide the supportive need for the individual or the youth to overcome whatever challenges that has to do with their mental health. Thank you.
Thank you so much. What a great answer to understand the feelings behind the words. Okay. We're going to open it up to the audience. We'll take 2 questions. You'll ask them one after another, and then we'll offer it to the panel to respond. So I see 1 question here, and anyone else so I can prepare? 1 question here? Okay. We'll do 3. Yeah, 3. I see you.
Thank you so much. My question is, so we're having the conversation, and this is really encouraging in our community. How do we support someone? So I want to leverage on the point that we cannot, I wouldn't use the word force, we cannot impose choices when it comes to finding healing or the right coping mechanism. But how do you really help someone that is struggling with addiction or has a mental illness or mental challenges? How do you help them see that this is what they have, and now you leave them to make that choice or decision? So I will give a vivid example. Saying you have a relative that is struggling with substance use, and then this person cannot function like they should. They're usually out of jobs because this would affect their well-being at work, and then they would also move with people who would lead them to more harm. Either they use more substances, they engage in violent activities. So how do you bring that person, of course, who is black, to understand that this is the challenge they have, and then point them in the right direction? And it's not like you're not talking about it, but I'm just concerned that what do you really need to do, or are there other options that you can explore to help this person see that this is the challenge they're struggling with?
Thank you.
Are we answering immediately, or wait for all the questions?
We'll wait for all the questions and then just keep it in mind.
Thank you very much. I have a question here. It's I'll talk in general. My name is Asani. How do we equip new immigrants who just arrived in this country, if not in Manitoba, with awareness about this whole thing we're talking about here, like mental health? Because I have noticed that most of people, and I'm talking especially people who got here as refugees, they come with traumas, and when they arrived here, they're happy they just got their papers as permanent resident, and the next session to go do their resume and go to work. No one is looking at where they were coming from, what did they go through, and they just assume they're happy they're in Canada and they are fit to work. Now, I think that affects them because they're just in the new country, especially if they arrived in winter. They just found new weather, and they have kids to adapt, no transportation. So is any way we can create a kind of a network that's going to be targeting every society, every community, to get those people equipped with everything we're talking about here before they launch them to the labor market? Thank you so much.
Thank you. Great question. And then one last question at the back here.
Hi there. My name's Nicole. I am Indigenous. I'm a Cree woman from Pimicamac Cree Nation, Treaty 5, Cross Lake. In 2016, there was a national epidemic because youth were killing themselves at an unprecedented rate. In the span of 2 weeks, there was over 140 suicide attempts, the youngest being 8 years old, unalived himself. This was in 2016, before the world went to shit. So things are way worse now. In 2013 and 2014, I volunteered to work at an orphanage in Kenya, and these kids had nothing. They barely even had clothes, they barely had a mattress to sleep on, and they ate plain rice and beans every single day. And they were the happiest human beings I've ever witnessed in my life. And that changed something in me, and it stuck with me to this day. My son is 10 years old, he's half Jamaican, and I'm worried that he's gonna go down this path of mental health issues the way I have and many people in my family have. So my question to you guys is, for someone like me who is building a business focused on this issue, how do we cultivate that same happiness that we saw in these children who have nothing, no families, no parents, so much happiness? How do we bring that to the reserves where these kids are killing themselves? How do we cultivate that? I need to know. Thank you.
Thank you. 3 very strong questions. I will quickly summarize. One was on supporting someone, an individual who is experiencing challenges when it comes to substance use without telling them what to do, but how to be there for them. And then we have another question on supporting newcomers from specifically refugee situations who come with trauma, how to provide services to them beyond just career services, but also looking at the root of the psychological well-being of where they are. And then the last one was on the situation of supporting children and youth who are experiencing mental health challenges and pushing them towards happy activities and better supports. So I'll pass it on to the panel. Feel free to answer maybe just one out of those questions, and you can go ahead.
I like question number 1, so we're going to do that one. Couple things that come to mind. So the first would be something that stuck out for me is you repeatedly had asked, how do we get them to see what they're struggling with? So what I would say is, I want to say it's not your job, but show them love, right? So number 1, say what you see. Don't say it in a judgmental way, right? I noticed you went out last night and you got beat up again. Or I noticed that you were using and you missed work. You know, I noticed that you lost your last 5 jobs because of this. No judgment, right? Just, this is what I noticed. Say what you see. And then we want to stop enabling. So if you lost your job and I'm paying your rent, there's no consequences, right? So you need to stop enabling. Say what you see. I had 4, and I'm getting all excited here. Dang it. Yeah. Shoot, I'm going to have to find you after and tell you the rest because my mind has just gone out. But I think what ends up being the most important in the context of that situation is that you're not trying to get them to see it is in some essence trying to get them to see what you see, right? You don't want to do that. You want them to figure it out themselves, because even if you say, hey, this is your problem, and they agree that, yes, that's my problem, are they really internally agreeing, or are they agreeing with you to get you to stop talking to them about it, right? Also, when I was an addict, when people would get on me about what I was doing, I didn't have an opportunity to think about what I was doing because I was too busy defending myself. I was too busy making reasons for you to be wrong, which meant I never had a chance to actually sit with what was going on in my life, right? If somebody had come to me and said, hey, I see that there's a lot of really dangerous things happening in your life, and like when you're doing this thing, this happens, you know, I love you, let's go out and eat. What am I defending myself? That's going to sit with me for weeks afterwards. I'm going to be thinking about that person who loves me, who was there for me, right? Who sees me hurting, sees my pain, doesn't offer me judgment. And so I think it's also important to get out of the way and let natural consequences happen. I remember what I was going to say now. The other thing is I have had a couple clients that have come in and they don't see it as a problem, whatever they're doing. But I'll just talk about one, for example. She was using crystal meth and solvents, and she didn't think she had a problem. But every time we talked, she talked about her memory. I can't remember anything. I've got such a bad memory. And she would be so frustrated, and she felt so stupid. So I went and got some handouts and brought them back to her. And I said, oh, this is how crystal meth and solvents affect your brain and your memory. Because her memory was important to her. What do you think she did? She started changing her substance use behaviors because she wanted to protect her mind. If I had told her, you're an addict, you need to stop that, she don't care, right? People use not just because they tried something new and it was love at first sight, but because they're hurting. They don't feel like they belong. They don't feel welcome. They don't feel accepted. They feel like there's something wrong with them. They're ashamed of something. They've witnessed abuse. They're hurting. And that's their way of maybe not even acknowledging the hurt, because sometimes acknowledging the hurt means that my mom failed or my brother did a bad thing or whatever, right? So I'll just take it all and I'll just keep it, right? So we need to let them learn from their mistakes, yes, but also be a source of love. This is the last thing I'll say. It's my favorite thing to say here today. There's 5 to 6 stages of change when we look at any change, whether I want to quit smoking, whether I want to work out, whether I want to quit doing drugs, right? So pre-contemplation, that's like everybody can see that I have a problem but me. If you think about an abusive relationship, right? She's in there, oh, he's so great, he loves me. Okay, right? Contemplation, maybe there's something wrong here. Maybe this is an issue, right? Preparation, okay, this is an issue. What can I do to fix it? Maybe I need to go to treatment. Maybe I need to go to a shelter, whatever. And then from preparation is action, so I'm not acting on the plan. And then there's maintenance. Some say there's termination, which is like, you don't even think about that thing anymore. You've made the change, you've maintained it, it's not even a thought anymore. When you're in pre-contemplation and contemplation stage, you need information, not judgment. You need information. You need information and you need connection, you need love, you need relationship. Because I don't care about your information if I don't feel like you care about me. And me saying, well, I love you and I want the best for you is still you wanting what's best for you. Because you don't want to feel guilty or upset that I'm a mess, right? That doesn't work either. Yeah.
Thank you so much for that
I think
answer.
I want to add to.
If we can
I'll just
actually
quick
move
one.
on to the other questions, if you can take, there was a question right here and a question over there. So if we can continue with those themes, and then I'll take one question in French to wrap up the panel.
All right, so let me just quickly, I'll come to your question. I agree with everything the other panelists said, and it's Bossa Day, right? Yeah, so excellent question. The only thing I'll add to that is we've got 2 sayings that actually address that. The first would be, it takes a village to raise a child. And also, there's another one, a rising tide raises all boats. Why do I mention these? Sometimes it is so difficult for a parent, either a single parent or a 2-parent household, dealing with a child, could be an adolescent, a teenager, whatever, or young adult. And sometimes you have to, again, walk past that stigma and do something that is not part of our culture. It's new for us, but it works, which is get other people involved. Maybe get your extended family involved, or get that friend of a family or adults that this child might listen to. The good old thing called an intervention. Because children are designed not to listen to parents at a particular age, but they might listen to somebody else who they respect. And you know your child more than most people do. So if there's an uncle, an auntie, several of them, that you can get to join you in this struggle, to say, please, you lack an insight into your problem. It's causing you to lose your jobs. It's causing you not to get to your full potential. Perhaps if you have uncle or auntie that you might listen to, it might help. So it's not just all that pressure on you, because you have to pity yourself first. So that would be what I have to add to what she said. Just don't make it only you. Go past that stigma, get other people involved, because it takes a village to raise a child.
Thank you.
Quickly to your question about access to mental health, I would say we should do a better job of having more websites that have contacts for where people can go to. You coming for this, for instance, is an excellent way to do this. At the end of Audrey Gordon's talk, she had phone numbers and websites, for instance. So I think part of what Ambition and the team should be looking at doing is perhaps having better websites where we can have all these contacts to access all the different aspects of mental health that we need help with. So addiction for our children and ourselves, psychotherapy for families that are fighting because it's so stressful to be here, access to services that would help a new immigrant coming in, even if it's services that say, hey, if you want to recertify, these are the colleges to go to. It's all about information. The other thing that I find that has helped quite a lot of people would be good old WhatsApp groups. WhatsApp groups or Facebook groups where you have all this information, where you have all these contacts as much as possible. The only thing you should be wary of is, unfortunately, there's a lot of misinformation sometimes. So you'll have to have that level of check-in to be sure that you're getting the right information as much as possible. I think I wouldn't be able to address what you talked about, and I think I'll leave that to someone else in the panel to do that. But those are the thoughts I have about the questions that you both asked. Thank you.
Thank you so much. So we're going to take the last question. Let's keep it brief just to respect everyone's time. We also want to take a Francophone, a French question. So yes, keep the remarks brief if possible. I know it's very valuable information, but we want to make sure we respect everyone's opportunity to speak. So for the last question.
Sure, I don't know your name. Nicole, let's talk after. But I think foundationally, again, it's that disconnection to culture. Even folks that are quote unquote living on reserve are not necessarily connected to the original teachings and land-based teachings. So land-based camps, land-based therapy, lots of like trauma healing. When you live in a community that all around you is death and despair, that is what is going to be mirrored, right? And so that epidemic was horrible, I remember, and horrible to witness and to hear about. And so for me, it's like going back to those land-based healing practices, going back to having elders being the caretakers of the community, not talking about chief and council. I'm really talking about kind of our elders that carry those teachings and knowledge keepers. I also do know some amazing Indigenous therapists that do fly into communities to do a lot of that work, so we can talk about that. But I think part of it, and maybe to make the parallel with, is kind of healing modalities that are of your culture, whatever that may look like. And we don't need to bring in Western ways of being and doing. And there's a reason. This is the colonial impact, right? What that was a result of the colonial impact, and so we can talk later. But I wish you well also on your own personal journey.
Thank you so much. So we're going to take one final question in French. I will pass it to the back. I can translate for the panel, and then we will hear responses.
Merci beaucoup. Je pose cette question, je crois, deux questions à tous les intervenants. Mais excusez-moi, je le pose en français. Le nouveau arrive. En fait, ma question est axée beaucoup plus sur l'aspect psychologique des nouvelles arrivants. Les nouvelles arrivants sont confrontés à beaucoup de choses liées à leur intégration, entre notamment la barrière linguistique et puis l'intégration culturelle. Ça crée l'isolement. Comment détecter quelqu'un qui est autour de toi, qui subit cet traumatisme psychologique? Et quels sont les mécanismes que vous pouvez mettre en place pour communiquer aux nouvelles arrivants qui sont isolés dans leur maison, qui ne savent pas comment défier cette barrière, car ils ne savent personne, ils viennent d'arriver, leurs familles sont loin, ils sont là au milieu de nulle part. Quels sont les mécanismes que vous pouvez mettre en place pour détecter ces gens-là partout où ils sont dans leur maison, dans leur isolement? Voilà ma question. Merci beaucoup.
Thank you. So in summary, his question asks, how do we recognize newcomers who are experiencing layered effects of language barriers, isolation, being in a new country away from their families? How do you recognize those challenges? And secondly, what kind of mechanisms can we use to support them when they're feeling isolated?
Thank you for the question. Merci pour la question. I think it's best if I answer in English.
If you can answer in French, because he would like to understand
bon,
it.
Mon français n'est pas parfait, mais je vais essayer de répondre en français. Je pense, premièrement, c'est tellement important quand on demande quelqu'un, quand on salue quelqu'un, comment ça va, il faut vraiment demander comment ça va. C'est pas juste, oh, ça va, oui, ça va bien, toi. Like, non, il faut prendre le temps, prendre une pause, vraiment demander la question, comment ça va, et attendre pour une réponse authentique. C'est très important d'être curieux sur les expériences des gens. Je ne peux pas lire les pensées de mes amis, des gens de ma communauté, mais si je suis ouverte à apprendre de leur expérience, ça peut faire une différence. Je me souviens, ça m'est arrivé à moi, quelqu'un m'a demandé comment ça va, j'ai essayé de répondre honnêtement que ça va pas bien, et elle m'a dit, il fallait juste dire ça va, continue avec et puis ça m'a vraiment fait mal. Oui. Parce que, alors il faut pas demander, et puis la raison que je dis ça, c'est parce que, pour moi, ce que j'ai appris, la leçon que j'ai appris là-bas, c'est maintenant, quand quelqu'un me demande comment ça va, je continue à répondre honnêtement pour qu'ils puissent savoir que quand je les demande, ils peuvent être honnêtes avec moi aussi. Et je vais leur donner l'espace pour répondre honnêtement. Une autre chose, c'est, je pense que on doit aller au niveau des organisations communautaires. On a besoin d'avoir des groupes qui sont disponibles à joindre pour les nouveaux arrivés, donner des chances aux gens de discuter entre eux pour faire des nouvelles connexions, rencontrer des nouveaux gens. Quand tu vas au centre d'immigration, quand tu commences à chercher pour un travail, quand ils disent « Oh, viens au centre Flavie pour acheter des nouveaux habits ou des meubles pour la maison », si on peut avoir là-bas des avertissements pour... Il y a un groupe qui se rencontre chaque mercredi et vous êtes invités, on va partager. Peut-être on peut, quelqu'un comme nous qui est expert, qui va juste commencer à poser des questions ouvertes. Comment est-ce que ça va au Canada? Qu'est-ce qui est difficile pour vous être au Canada? Est-ce que vous sentez comme si vous avez l'information que vous avez besoin? Est-ce que vous savez, les écoles, le travail, les amis, aller au docteur, toutes ces choses-là, tous ces détails-là. Parce que c'est vraiment difficile, déménager à un nouveau pays, recommencer tout seul. Il n'y a pas beaucoup de Français au Manitoba. Ça, c'est honnêtement, je pense on dit que Canada est bilingue, mais vraiment, Montréal est bilingue. Canada, Manitoba, c'est pas trop, right? C'est pas la même chose. Alors, et pas tout le monde peut habiter à Saint-Boniface. Alors, je pense que, vraiment, si on pourrait avoir plus de... Et je pense que c'est à nous, nous les experts, nous les gens qui ont fait ça pour le travail, c'est à nous de créer des groupes, des opportunités pour se mettre en communauté, right? Dans nos cultures, on fait rien seul. Comme monsieur avait dit, it takes a village, right? On doit le faire ensemble, comme village. On doit prendre soin de nous, entre nous. Yeah, je vais le laisser là. Sorry, Julie.
Don't say sorry. That was very impressive in French too.
Try to translate, and I think that actually.
Hand of applause. Yeah, that was incredible. I will just quickly summarize. You said sorry, but that was amazing. Okay. What she said was, when it comes to supporting newcomers who are feeling isolated, we have to have the courage to ask people how they're doing, and also be ready to listen to what they'll really answer. She shared an example of how somebody asked her how she was doing, and she said she wasn't doing well, and the person responded, "You should have just said you were okay. No one has time to hear the story." And she felt very upset and frustrated by that. And that just goes to show that when you respond to someone in that sense, you make them shut down towards truly opening up about how they're feeling. So when you tell someone truthfully how you're feeling, you're also inviting them to truthfully tell you how they are feeling in return. The second thing that she mentioned was we should not just wait for immigrant communities and newcomers to find resources. Sometimes us as service providers and professionals, we have to meet people where they are in their communities, whether that means going to a group setting and sharing information about resources at Flavie Laurent, which is a Francophone community group here. So we have to also find ways to meet people where they're at and not wait for them to come to us. So once again, emphasizing that it does take a village. So we have to reinforce that village and find people when they need that help, when they're struggling through isolation. So thank you all for sharing your expertise, your experiences, your lived experience. The questions were hard, but very, very enriching, and I really appreciated learning from all of you, and I'm sure the audience participants did too. So let's have a round of applause for everyone at the front.
Can we have an additional round of applause for this amazing translation?
Thank you. All right, we will proceed with the next order of events. Thank you to our panel.
Thank you.
Thank you. All right, I want to do a pulse check in the room. How are you feeling? It's gotten a little bit more quiet than when we started. That's okay. It's tough, sensitive conversations and topics. What we are going to do now, as we have gone a bit over time, we're going to conclude the formal part of the event. However, you are still welcome to visit the exhibits at the museum, and there are still some small group discussion questions. If you feel comfortable and want to continue the conversation, there are facilitators around the room who can guide you through those small group discussions at the end of the table. But also, to be respectful of everyone's time, we'll conclude it here. And I just want to quickly thank the whole team who put this event together, for everyone who came and took time out of their days to be present here. And I really want to encourage you to take a few things from what was shared from the panelists, the keynote speakers, and even from the discussion questions that we had on the table. Take that and don't stay with it. Take it back to your families, take it back to your workplaces, and take it back to your communities. This is only the beginning of the conversation, and this is something that needs to continue if we really want to see tangible change within our communities. And even more so, I give you the challenge that for the next event in October, bring a youth. I want to see more young voices and more experiences, so that we're not just talking for them or about them, but we're also talking with them, because this is something we need to deal with and change together. So, you're welcome to now go explore the museum, as I mentioned, or join the small group discussions that will be facilitated by leaders in the group. And then there's also a networking section here that you can talk with each other. There will be some light snacks that you can take from. But this also concludes the formal part of the event. I thank you all for joining us today, for your time and for your participation. And I hope you have a nice rest of your weekend.
Hi, everyone. I forgot to quickly mention that we are collecting feedback. There's a QR code that is blue on your tables if you want to give feedback about the event and share what you'd like to see more of or less of. We would really be happy to receive that feedback. Thank you.
actually looking for device cockpit connector. And on this one, so I can connect it to this one. So we need to block it. I said there is a dock station which has right here. I can connect this and from the back. Just leave it this way. Yeah, so this is the only device we can use right now for it.
This won't work on an iPhone?
Yeah, this one should work on iPhone.
Is there a way to not show the screen?
Yes.
Okay.
Yeah,
And this
not really anything, so you just run the screen. Oh, is it on screen?
Music?
Oh, okay, sorry, is that without cable?
The music? Yes, yes. There's a Bluetooth connection, so if you have like either the iPad and you want, we can connect via Bluetooth to ours.
Okay, so
if you go to Bluetooth, it is going to be the Wi-Fi high-res one.
So I did connect it the other time. Now it's connected.
Yeah. Once I'm just gonna grab our iPad to make sure that that's
Oh, okay.
set as well.
Okay, thank you. So you can plug it. You can plug this one.
So what was the concept of someone who has been running?
Just to get an idea of what the community thinks about factor Let's give that a try.